Hello, this is Dr. Dana Brackney, and I wanted to welcome you back from our break to our course this semester together, which is Health Assessment for Adults, Nursing 5150. RNs in general do not use all the assessment skills that we have acquired to benefit our patients. And so your role as educators, whether that be with other staff RNs or in baccalaureate programs or ADN programs, you will have the opportunity in some area of assessment to help RNs to feel more confident and more proficient in performing and interviewing for purposes of advancing people's health. So your degree and this course is an adult health degree. So for many of you, that's going to be a specific challenge because you work with neonates or children. And I want you to know that I understand this, and I'll be here to help you be successful in this course. You may adapt some aspects of the course, such as our unit discussions, to your interest area with children or neonates, but the actual physical exam and interview components that we're doing will be directed at adults, because if you become a clinical instructor also, that is the primary population that you work with, unless you're employed by a huge school that has multiple sections of all kinds of specialties. Most schools need you to also be proficient in elements of assessment related to the adult. The second consideration that I had then is about you as the educator. So here's an amazing thing. As we all know, technology is never leaving education at this point. It is here to stay. And this course involves use of shadow health, which is artificial intelligence. And wow, it has really improved since I first considered using this in this course. So 5 years ago, I said, no thank you to it, because it just wasn't developed far enough along. However, now it is much better than it ever has been. And however, it will be frustrating. There will be glitches. It will be annoying. And to that end, I want you to know that I have weighted the course so that while the shadow health assignments are an important component of our course, they're not meant to be implemented with perfection. So usually what I find is students themselves are so hard on themselves to get 100% of all the different aspects that they can end up spending too much time on this area of our course. So I wanted to alert you to that so you could kind of get the right mindset about what you're doing, because although I think the software is very helpful, it's not the be all end all. If you have trouble with shadow health, it doesn't mean you're a horrible RN and have no skills. It simply is a different type of platform and requires slightly different skills, but I still believe there's enough educational benefit in it that you can do well. Let's see. So as you have problems with that, you can let me know about them. I'm probably aware of the challenges, but it's good to have a positive aspect of saying, I'm going to see what I can learn using this technology instead of wanting things to go perfectly with it. So let's talk for a minute about grades. I think I'll show you that when I show you the syllabus, but there's calendar due dates, and this particular course, if I remember correctly, runs from Tuesday to Tuesday. So assignments in your course will be due on Tuesdays. So as an educator, I'm just letting you know that I have an undergraduate course and my assignments in that course are due on Monday, and I have another master's level course, and that course I have assignments due on Wednesday. So as an educator, I have modulated and adjusted the timing of assignments so that I can be grading it. No reason for everyone to turn things in on Monday if I'm not going to be looking at it till Thursday. So just be aware that's for your future educating self, that you can go ahead and sometimes you can set up your semester for success that way. And the Shadow Health platform doesn't communicate with our gradebook. So I had to create a stand-in assignment to form the gradebook and As You Learn. So you will see Shadow Health assignments and all you have to post in there is done. And then I will use that primarily to enter the grade. Sometimes I'll ask for a reflection question or something in there. So just be alert to the instructions on each individual assignment. But that is some of the technology glitches that we encounter in education. There's going to be 3 units in this course. One is on ethics and values. One is on evidence-based assessment and patient education, including SBIRT, and the others on communication and culture. So our first one will be communication and culture. And remember, these 3 units have been chunked. Another educator term, they've been chunked so that to organize the class around these overarching concepts. And then there's content, not so much specific to the unit, but folded within the unit surrounding health assessment. Oh, and a word about materials and books. You can use any health assessment textbook that you want. I tend to use Jarvis or Bates, but you can choose whichever one you want. The required book in this class is the Danes textbook, and that will be that's the advanced practice element of your continued education. So that will help you with critical thinking and understanding how we pull together the assessment pieces to form a diagnosis. This is also helpful because you will be often guiding people in their evaluations of patients. So it's important that you have this higher level of critical thinking now that you will become an educator. And then Shadow Health is also a required text in this course. There's going to be 5 regional assessments. So the body, when we study it and teach it, we often teach it based on a system. So for example, we might teach the cardiac system. But when we do an assessment, we don't listen to the heart, look at the legs, listen to the lungs. So we don't do this like based on that particular physiology. Instead, when we do assessments, we assess like the face, the head, the neck, and then we move next to the chest. We are assessing in the moment we see someone, where we're looking at how they move, how they talk, what their affect is like. And then we assess the lower body. So just realize that the way that your performance will be measured is by region, but the way that we're learning and studying is by body system. So those are the 2 different features of this course. So now I'm going to share my screen with you and show you the syllabus so that I can walk you through some of those elements. Okay, here we go. So most of this is fairly standard language. I do want to show you the objectives because the very first assignments in Shadow Health and in this class revolve around in-depth interviewing techniques. And then we're also going to study motivational interviewing as a way to support patient education and health behavior change. So we're doing that. We're going to use the Danes textbook and some reflection questions in Shadow Health to appraise data collection and its interpretation. Then you're going to modify techniques, and we'll talk about different populations with cultural changes you can make. And this will include some genomic questions that we do. And because there's an emphasis in our program on rural populations, we'll go through some case examples there. And I've got some stories to share with you along the way. And then we're going to look at social and ecological determinants of health. And there's especially some of the midterm and final exam questions revolve around analyzing reports and statistical information you might have about risk to understand, like the person that's sitting in front of you, what might their unique risks be because of social and ecological determinants of health. That is the one aspect of diversity and inclusiveness in our course, as is the genomics. And then synthesizing all that information and being able to communicate. There's documentation. We're going to use the old-fashioned SOAP note simply because of the way it helps us organize data, and it allows me as an educator to see the critical thinking piece that you have put into your documentation. So I recognize that systems, electronic systems work differently, but I'm more interested in the thinking than the actual language in your documentation, if that makes sense. So here's some specific course outcomes. And the reason this is important for me to show you here is because next year at this time, you're going to be doing a course with me called Instructional Strategies. And these headings are all educator terms related to Fink's significant learning. You'll learn some more about that next fall. And then those are specific kinds of examples of student learning outcomes under each. So as an educator, you should begin analyzing the syllabi that you're encountering and thinking about how that guides or does not guide the work in the course. So those are all objectives that I have. Here's the textbook. Here's the Shadow Health with a pin to direct you to how to enroll in that course. And it is beneficial to use headphones. It seems to capture your voice better since there are voice recognition parts to that. Writing center information is unchanged, as is the grading scale, and these course policies are the same in every course, but I wanted to show you here the graded assignments and just making sure you're aware. So there's 14 different Shadow Health assignments. So this is very different than your coursework last semester, because there's little bites of work kind of all the time that we're together. But those are only worth 1% of your overall grade. So if you have limited time, and who doesn't, you want to be sure to understand which assignments are weighted more heavily than others. Likewise, the regional physical exam, while an important assignment to help you prepare, it's considered a formative assignment. So each of those are only worth 2%. However, the unit VoiceThread forums and the Shadow Health focused exams are each worth 5% because they give us a measure of how you're doing with these bigger course concepts. Likewise, the midterm and final exam are weighted more heavily, and the end of course assessments. So really, by the time you're through the midterm, if you notice, there's still about 50% of the course yet to be graded. So just be aware of that. And next I want to show you, and this describes in detail all of these assignments, but I want to show you how I grade the Shadow Health. So although you get a score, which is called the DCE score, I take that score and multiply it by 0.4, and you can then get up to 30 points for that part. Then I go in and I actually read your transcript. And I'm looking for very specific things. So I really want you to introduce yourself saying that you are an RN, a registered nurse, not just a nurse, a registered nurse. And this has become very important for our profession, and I'll talk more about that. But for right now, I want you to say, for your communication, I'm expecting an introduction, saying who you are, saying about how much time you'll spend together, and then asking questions in an organized, non-judgmental way. And then also I examine how the empathy and education score within the DCE score is specifically working. And then at the end, I know you are just going to be tired with Tina, but I need you to thank her for her time and cooperation, and perhaps set an appointment for her next meeting. Say, I would like to see you back in 2 weeks, or I'd like to see you back when you have any other problems. You need to have a closing. So that's what I'm looking for there. Then there's documentation along with it. It's similar to the electronic, most of it is similar to the electronic record, but with detail, students usually do not have much difficulty with this. And then there's some review questions asked at the end. And I'm looking for differential diagnoses and assessments that are part of those reflection questions, and review questions. And then you always complete a reflection. And this might seem tedious again when you're so, you've probably focused so hard on the other part, but notice that the reflection is worth 10 points. And so that reflection is supposed to relate to the unit topic. So I want you to reflect on the assessment you did with Tina. The first 5 weeks, you'll be reflecting on culture and communication strategies you used. And so that's how you earn those 10 points. And then at least 30 minutes spent with Tina will earn you 5 points. So I wanted you to see that the self-reflection documentation, some others of these pieces aren't just like little add-ons. They actually earn you points in that assignment. And I figured that's important for you to know. I have examples of rubrics in use. I do all of that grading and communicating in Shadow Health. So then there's a unit discussion, voice read rubric discussions, and these will run from Wednesday to Wednesday. So this says the Monday that it closes, but this will actually be the Wednesday. So I see that here now, and I need to go in and adjust it. Just when you think you've made all the edits, the course is going to run Wednesday to Wednesday. So I'll make that change. And you'll see that in the calendar within the course that those due times are done. And so in this case, for the unit, I want you to have a whole week to respond. If I remember correctly, I'm sorry, I've got so many discussion boards going in different formats in different classes. I may have to edit this out. And here's your course content, and just like an overview of what you will already see in As You Learn, and then the dates that activities will be done and due throughout As You Learn. So this will give me an opportunity to check on this unit assignment if I have it correct on the calendar or not. So let's take a look. It should be okay, so the responses to peers are due on the 16th, and that is actually a Monday. So forget what I said, the syllabus is correct. This is because it's a unit, I guess we're operating slightly differently. And so the first post is due on the 9th. And then you have 7 days later. So these posts are a little different than our Wednesday to Wednesday due dates. So anyway, thanks for letting me learn along with you. And always, if you're having difficulty with a due date or a problem with a course assignment, please communicate to me about it. Often due dates, when they don't involve others, can be tweaked a little. I don't like to put things off too far for you because the work just piles up. But if you're having a problem getting something done, communicate to me and let me know when you do think you can get that by, and I will set that as your due date. And I can modify that if you need. I believe the way I've spaced this out enables you to do it comfortably, but you of course can let me know if that is in fact working for you or not. We all are coping with various stresses and strains on our lives, and I want you to be successful in doing this work. So I don't want you to see me as a barrier. I'd like you to see me as a partner with you in doing it. So let me know the challenges that you're facing, and I'll see if we can do anything about those without decreasing, of course, the standards that we have. App nurses have an excellent reputation throughout Western North Carolina and beyond. So we want to continue that spirit of excellence in all we do. Thanks for joining our course and for listening to me slog around through the syllabus. Have a great day.